Okay, good morning. Great, thank you. We wanted to start the day with a little framework that acknowledges that reproductive oppression and state-sanctioned violence against pregnant people didn't start with Dobbs, right? Pregnancy has been criminalized for a long time. Other forms of reproductive oppression have occurred across communities and intersected with other systems that deny people their human rights. So to that end, we wanted to start with a little bit of history of how that happened, so we would kind of understand how we got to this moment and what we can maybe foresee. Some research about how people what strategies people have used to overcome the restrictions on abortion or criminalization of pregnancy or other forms of oppression. Some real world experiences about how other systems also impact people's ability to get reproductive health care and how they can both seek to avoid criminalization. We hope that is a useful starting point for as we go further into the weeds on these topics, into like the real legal nitty-gritty, to have a framework that we can all come to the work with the rest of the day. So to that end, I'm going to ask each of our panelists here to introduce themselves, talk about their organization, the work they do, and their mission. So we'll start here left to right. Mahati, if you want to go first, and we'll go all the way around.
Hello, is this working? Can everyone hear me? Okay, great. Hi, I'm Mahati. I'm a legal fellow at Pregnancy Justice. Pregnancy Justice is a legal nonprofit that works to provide legal assistance to people dealing with pregnancy criminalization in whatever form, as well as doing public outreach and education, and as well as doing research and tracking into cases of pregnancy criminalization across the country. And I'll pass it on to Carrie.
Thank you. I'm Carrie White. I'm on the faculty here at the University of Texas at Austin in the School of Social Work and Department of Sociology, where I lead the Texas Policy Evaluation Project. And I'm here in that capacity today. We are a team of clinicians and researchers who are looking at the different impacts that Texas's policies and laws related to contraception and abortion have on people's access to care, service delivery, and people's experiences trying to get the reproductive health care that they need. We've been doing this work for about 12 years and continue to have a lot of opportunities to look at these topics given the nature of politics in Texas.
Hi, my name is Heather Allison. I use she, her pronouns, and I am the Public Policy and Communications Associate at Fund Texas Choice. Fund Texas Choice is a practical support fund, meaning that we fund the costs associated with someone traveling to get their procedure rather than the procedure themselves. So that's typically flights, but can also be hotels, childcare, or any other practical support costs they might need.
Good morning, everyone. I'm Kathy Torres. I use she, her, and ella pronouns. I'm the organizing manager at Frontera Fund. We're the sole abortion fund in the Rio Grande Valley on the border. We fund people from Brownsville all the way to El Paso, so the entire border in Texas. Historically, we did provide practical support, but the landscape has changed. I also lead the helpline, so I take all of the calls for anyone who is seeking care out of state. And yeah, thank you.
Good morning, everyone. My name is Marcia Jones, and I'm from Dallas, and I'm the executive director and founder of the AFIA Center. The AFIA Center is, I would say we probably still are, one of the only Black reproductive justice organizations in North Texas that was founded by Black women, directed by Black women, and unapologetically we serve Black women. The organization was founded, not necessarily, it was founded, and I'll talk about that more on my next response, but we were founded to respond to HIV among Black women. I mean, it's like this insanely high prevalence of Black women in Texas carrying the burden of that disease. And so we founded the organization to address that. And the idea was not to address it from a behavioral standpoint, but to really address it from the root cause of it. And the root of it was racism, race, class, and gender. I mean, we know that black women die, black women carry extra amount of burden with health simply because we're black. I mean, it's not our blackness that kill us, it's just the way the world treats us. And so that was the reason that we started the organization, but also we had to look, in doing it that way, I was like, well, there's some other things that's going on too. You know, what about, you know, folk in our communities getting pregnant and being forced to carry full term because the idea of choice didn't even reside in the places where I lived. It wasn't even a conversation where I lived. So that was the thing that was happening. And so as time went on, the work that we did expanded. And so now we did, again, we became a fund. And we knew that we would always help in that way, but black women called on us and was like, hey, you know, we need some help getting an abortion, or we need this. And it was one particular, the young lady just said, hey, I was like, there are funds, you know, that's not what we do. She said, yeah, but I want you to do it. And so after that happened more than 3 times, I told my program director, I say, I guess we are a fund now. And so that's who we are, that's what we do. We do a lot of stuff at the Field Center, so.
Great, thank you. Thank you all so much for being here. And I'm very much looking forward to the conversation that we're going to have together, and we'll have a chance to bring in the audience as well. As Blake already suggested, Dobbs has made many of us think about criminal law and the criminalization of pregnancy in ways that we maybe hadn't had to before. But the criminalization of abortion facilitated by Dobbs is likely, we think, to follow patterns that we've seen in other contexts, including around reproduction and pregnancy. So I wanted to start with Mahati and Marcia, who, as you've just heard, are both working for organizations that, along with If, When, How, have been responding to the criminalization of pregnancy and reproduction for many years. And so I'll start with you, Mahati. And pregnancy justice has been around for 20 years now. Some of us knew the organization as the National Advocates for Pregnant Women. And the organization has engaged, and still does engage, but in direct criminal defense representation, in various forms of advocacy, and is engaged in a lot of research charting the ways that pregnant persons have been criminally charged for their own pregnancy outcomes. So we'll start with everyone with a question and a follow-up if we have time. But could we begin maybe by getting you to give us a brief overview of what you've learned about the types of criminal charges that have been brought against people for their pregnancy outcomes? And I think it'd be really useful to know how law enforcement and child protective services became involved.
Yeah, absolutely. And it is a big question, so I'll try to be brief, and I will allow follow-up during the question and answer section if anyone wants me to expand. But I think I should start generally with a definition of pregnancy criminalization. Pregnancy criminalization essentially means that if not for the pregnancy status or pregnancy outcome of a pregnant person, there would be no crime. And that means that otherwise legal behaviors become criminal solely because a person is pregnant. And what does that look like? There was a case back in 2021 out of Alabama where a pregnant person was charged with prescription fraud for essentially using prescription drugs that were given to her by her provider because she was pregnant. And when she went to the hospital to give birth, she tested positive for opiates. And in any other circumstance, if not for her pregnancy, there would be no crime. No other person is charged with prescription fraud for using legally provided prescriptions to treat their chronic health pains. So that's in a sense of how pregnancy criminalization certainly works. And in the crux of a lot of these cases, what comes to be like the legal concept enforcing lots of pregnancy criminalizations is this idea of fetal personhood. And fetal personhood is the legal concept that fetuses have the same rights and legal protections as any person. And more sinisterly, it has been interpreted to mean that the needs and rights of the fetus are diametrically opposed to the pregnant person. And there is absolutely no way for the fetus to have those rights without diminishing the rights of a pregnant person. It makes pregnant people into second-class citizens in their own bodies, in their own medical access, and in the way that they are viewed by the courts and legal systems. And what we have found from our research is that since 1973, so since the inception of Roe, there has been 17,000 cases of arrests, criminalizations, forced medical interventions against pregnant people because of their pregnancy or because of their pregnancy outcome. And who are those people that are impacted? The majority of them are women of color, the majority of them are poor, and the majority of them, I believe around 80%, are people who have used drugs. And drug use tends to be an entry point for many of our cases because it is highly stigmatized in this country. There is very few people working in legislatures or in DA's offices who fully understand what drug use during pregnancy looks like or how it impacts the fetus, child, parent. In the majority of our cases, we also have healthy birth outcomes for children, despite the fact that they are being criminalized and sent to jail for drug use. And how it happens is that there's different statutes in place. There are statutes that criminalize pregnancy loss in some capacity that includes abortion bans, self-managed abortions, as well as feticide laws. I believe that about 38 states have feticide laws on the record, and in 23 of those statutes include early stages of pregnancy that would have allowed for feticide to be criminally charged even when Roe was on the books, as well as certain laws that have been reinterpreted since Dobbs that have allowed for criminalization of other things, such as abuse of a corpse for experiencing a pregnancy loss or stillbirth, miscarriage, as well. And also there has been uses of child abuse statutes and child neglect statutes to criminalize pregnant people as well. In a lot of these cases, we have found that the entry point for where these cases begin is in doctors' offices and in hospitals when pregnant people come to deliver their children. The majority, about 30% of these cases are initiated because healthcare providers, doctors, nurses, believe that they have a mandatory duty to report to CPS and the police of positive drug test results, and that initiates the investigations. And that's not necessarily true. Captain Cara does not create this ultimatum on doctors, but our healthcare providers and our healthcare systems are being treated as this site of carceralization for so many people who need to go to these places to have safe pregnancies. And yeah, I think that is a good point to end on. I want to be mindful of time.
Thank you so much. And I think that over-reporting is something that we've all been very concerned about. And so maybe with that in mind or something else, I wonder if you could share maybe one or two lessons from the work that the organization has done pre-Dobbs that you think might continue to be helpful, not only in the broader context that you're talking about, but also in terms of abortion criminalization.
Yeah, of course. The first lesson, because I know the picture I painted has been very depressing, is that there are ways to win. I don't think it's surprising to anyone to know that the science behind a lot of these statutes and these prosecutions is a bit bogus. So when you're able to bring experts in, when you're able to challenge the science, the autopsy reports, the medical records that the prosecutors are bringing in to show that a pregnancy outcome or a pregnancy loss was a criminal activity, there are ways to challenge that in cases where we have had people have home births and have stillbirth outcomes or miscarriage outcomes where prosecutors have charged them with homicide, feticide, manslaughter for that pregnancy loss. We have been able to challenge the underlying science to show that the fetus may have not been born alive. In many of these cases, they use this thing called the lung flow test, which is junk science, is basically the equivalent of the Salem witch trials, which is if there is lung in the fetus's, sorry, if there is oxygen in the fetus's lungs, that means that they were born alive, which ignores the fact that when matter decomposes, oxygen is produced. It is self-conclusive and it's false science, but it shows up and people are afraid to challenge it because it seems like doctors and medical providers can't lie in those cases, but there are ways to challenge those notions. And the second lesson is, and I think it's the broader reproductive justice lesson, is that we can't abandon anyone in these fights for reproductive rights. When we open the door for prosecutors or legislatures to over-police certain populations that are the most vulnerable, it allows us to open the door for them to take away all our other rights. So when we talk about pregnancy criminalization, we also have to talk about substance use and addiction. We also have to talk about sex work and immigration. We have to talk about all the other things that they don't want us to talk about because all these rights and all these people are linked.
Thank you. And that's why we're here today. So, Marcia, thanks for already telling us a bit about the AFIA Center and its history. And as you already suggested, you all really have been at the forefront of ensuring sexual and reproductive justice for Black women in North Texas for over a decade, and then you have started this abortion fund, but you're about much more than that. And when you are working on abortion too, you're seeing that and other reproductive issues through a through a reproductive justice lens. And you all talk about specifically these as part of intertwined systems of oppression, which include the criminal legal system and the family policing system, as Dorothy Roberts calls it. So I'd love it if you could begin by talking a bit about the ways in which both of those systems in particular have long had an impact on reproduction in the communities that you serve, and some of the work that you've done in response to that. And I'm thinking of the recent case of the CPS intervention in the Mila Jackson case that you all were so instrumental in helping with, but I know that's unfortunately only one of many examples that you could discuss.
Yeah, and I was going to say this about I'm going to come back to Mila, but yeah, that's only one, but the thing with Mila was really important because it's so often that people believe the hype. They believe that like black parents are really bad parents, or all of these things happen inside of our spaces that it justifies, kidnapping and snatching and robbing our children from us. Or there's this like extreme poverty, but I've never thought that being poor meant you could not love your children and be good parents. But with Mila and the Jacksons, for that to be spotlighted in that way, we were really able to highlight that this is, it's not what you think it is. You have this family here who was just not a typical family that would ever see themselves inside of a CPS case. So while I'm sure they did not want to be that family, but it definitely, it just highlighted CPS in a different kind of way for them to be that family. But as it relates to the work that we do, and the abortion work or not work, for the AFIA Center, it's all one work. It's extremely hard for me to separate it. I can't just look at access to abortion and not have access to abortion or all of this, because for the people that we serve, so Black folk bodies have always been criminalized. So like our body's been criminalized ever since we've been here. So that's not a real, like that's not like a novel thing. Black women's reproductive choices have always been criminalized, you know. So that's not a novel thing either. So I remember when the Senate Bill 8 thing happened, and this reporter called me. I don't even think like to talk to me, but this reporter called me, and he asked me a question, and so he said, "Well, like Marsha, what did you do? You know, with the passing of Senate Bill 8 or September 1?" I was like, "Well, I went and had breakfast because it was my birthday, you know, and he wanted me to just really be up like," and I was like, "Look." At our organization, we do not have the luxury or the privilege to walk around screaming and pulling our hair because this one thing happened. Because yeah, Senate Bill 8 happened, but we were still feeding people and providing mutual aid for folk who still were displaced from COVID. We still had people living with HIV, women living with HIV who still needed assistance from us. We still had black mamas dying. You know, folk were still dying when they was giving birth. So we do not have the luxury. And so if you ever get an email from me, at the bottom of my email, and this signifies the work that we do at the Affairs Center, all of my emails is signed with Audre Lorde's statement. And it says, and I'll just paraphrase it for me, we don't have the luxury of fighting single issue fights because we don't live single issue lives. And so I don't have the luxury to just, and while I do want people to have access to abortion, I believe in full bodily autonomy in whatever that can, in any way that's supposed to look. We don't have that luxury to even put all of this energy. I love all of the energy that's happening around the world right now as we talk about not having access to abortions. Just look at the kind of world we would have had people put that kind of energy when black women were dying from HIV and nobody was saying anything. And so I love what's happening right now because we get to put it on the stage. But the work that we do is it's a myriad of work. It is so, and it is unique because the way it happens with black women is not the way it happened with anybody else. And so we don't have that luxury. So yes, access to abortions it have to happen because when folk are having all of these unintended pregnancies, it just perpetuate generational poverty. And we can never find our way out of it. And so it is very important that people have the right to choose when it's right for them and when it's not. And you cannot continue to criminalize people who are already over-criminalized. So I ended with this. In the book, and I never write what I'm going to say, right? But last night I stayed up at 3 o'clock this morning writing this for y'all. And then I left it at home. I had some stuff for y'all, too. Yeah, I had some stuff, and I left it at home. But I was reading, I always read The Killing of the Black Body, especially when I'm going to talk about stuff like this because Dorothy gives you everything that you need. And so, black women's reproductive choice. So she started to talk about like in the 70s, in the 80s, at the height of the 80s, late 80s and the 90s, at the height of crack in black communities, crack cocaine in black communities, how black women were, black birthing folk were just tested for drugs all the time, didn't even know they were going to be tested, and their children were snatched away from them. Folk were having their children taken and put into child protective services. And when our children go to child protective services, many times we never get our children back. We don't. Our children stay there forever. And many times our children go to child protective services for small things like not having resources, not like having money. The very things that they give other people to take care of our children that they take from us. They give you money to raise my children. When had you give me money, I could raise my own children because you took my children because I didn't have money to give my children what you said my children needed. And so that is one of the things. And so she talked about that great deal in her book. Being criminalized for choosing to birth our choice. Mila's parents they took that baby because they decided to birth the way they wanted to birth, a birth of their choice. That at the end of the day, it was no different from what they did to granny midwives after Reconstruction. They took those women's ability to birth. They had been birthing all of this time, and they had not been losing families, and they were birthing white babies, they were birthing black babies, they were birthing people, and they just wasn't birthing, they were healing people. They were doing a lot. And they criminalized, they didn't criminalize it, they certified it. So they certified people out, and they were not able to do the work. And so this is what they're trying to do now. So this was an attack against that black midwife. It was an attack against that black family who decided that they would birth, and they would have a birth of their choice. And that is exactly what happened. White women have been having babies at home forever. And they've never had to get permission to have babies at home. They've never had to answer to their doctor when they brought the new baby in, when did you have this baby? When did you become my gynecologist? You're a pediatrician. You don't even have any business asking me that anyway. But that never happens. And so these are the things that we have to work so hard for. And that is why reproductive justice is so important. That is why I'm so happy to see all of this work as it relates to reproductive justice. Because if we do this work using a reproductive justice lens, then we'll be able to address these things, because then all folk, not just black folk, but all folk will have the full achievement of human rights and social justice. And then we won't be having these kinds of conversations. So thank you all for even having me here to even have this kind of conversation. I'm not sure that I answered exactly what you wanted, but I do have it written, and I can send it to you because I wrote it.
Well, then that's even more incredible that you did that with no notes. So thank you. I think you did very much answer the question, but I have a follow-up for you, which is the same question that I asked Mahatma. So any lessons, a couple of lessons you might share with us?
There's some great lessons. One of the really great lessons is that in the face of all of this, we've really had an opportunity to really provide people with an opportunity, whether this was the birth of their choice or not, that there are options for people, there are birthing options for people. We've been able to spotlight those options for people. We have a birth center now, and so we're able to assist the people in our community. And one of the really great things that came out of it is, I didn't even know, is that there's not a lot of resources out there for people who are caught up in the CPS system. And thanks to Birthing Justice, like, they were just like a game changer for the thing with Mila, because we were running up against all kinds of walls because we couldn't find legal experts in this area. And so once we were able to get with them, well, not we, but once the Jacksons were able to get with them, it changed the whole story for them. So yeah, now we know that so there were some amazing things happen. So we were able to spotlight all of these resources that we didn't know we had.
That's great, Marcia, and we're so pleased to have Leela Blatt here today from TRLA, who's going to talk, who is one of those experts in family justice, to talk about that intersection and have some resources for people's families who are facing that family policing separation system. So, Carrie, I've really had the luck of being able to rely on your and the Texas Policy Evaluation Project's research for a long time now in my advocacy work and learning what the laws that the legislature enacts, how they affect people's really access to care. And that has been, abortion care specifically, as well as access to other family planning services, has really been restricted for, going on 15 years now, but especially in 2013 or 2014 with the closure of like more than half of the abortion clinics in Texas really created larger obstacles maybe than what we've seen before without explicit criminalization. So is there anything you can share about what your research has found, or what you found about how that, and I guess after SB 8 also, how that de facto restriction and quasi-criminalization has changed people's ability to access care, and what you found,
Yeah. So I think we know that Texas has had a pretty long history of restricting access to abortion. I think some of the more dramatic instances have been in 2013 when the state passed policies that led to the closure of about half of the abortion providing facilities in the state. And what we have seen since that time, and that we really saw in kind of more shocking detail, is what happened with Senate Bill 8. But following all of these restrictions, we have seen an increase in people traveling out of state for care, people looking to self-manage their abortion, not that it isn't safe, but because they feel that they don't have any other option to try to end their pregnancy, and so they're looking for other means that would not necessarily be their first choice. And we really saw this come into stark relief with Senate Bill 8. And again, just a reminder, this was the law that prohibited abortions after the detection of embryonic cardiac activity, so at about 6 weeks of pregnancy, and also had this civil enforcement mechanism where people could be fined for aiding and abetting a prohibited abortion. And so what we saw during this time when SB 8 was in effect and before the Dobbs decision was not only a decrease in the number of abortions that were provided in the state of Texas, but a huge increase in the number of people traveling out of state for care. And I just want to extend a lot of credit to the folks at Fund Texas Choice, Frontera Fund, AFIA Center, the other funds in Texas and nationally that, like, without those resources would not have been possible. But just to put this in context, before SB 8, there were probably about 150 to 200 Texans traveling out of state every month, sometimes because they were too far along in their pregnancy to get care in Texas, other times because the nearest facility for them was someplace out of state because of the closures in Texas. We saw that jump from about 150 to 200 a month to 1,300 to 1,400 people traveling out of state every month. In some months, it was as high as almost 1,800 people traveling out of state for care. There were a lot of financial and logistic obstacles that people faced trying to make that happen because people were traveling at least 200 miles one way, but it wasn't uncommon to see people traveling 800 to 1,000 miles one way. Sometimes people would make these trips in a single day because they couldn't take time off of work. They didn't have other childcare options. So this was really, really burdensome for folks. But we learned a lot of other things from SB 8 that I think have relevance to what we might be seeing post-Dobbs. And this is from some of the research that we did, interviewing and doing surveys with hundreds of Texans who were seeking abortion care. And one of the things that we learned is that people weren't really sure what their legal options were. Even though a lot of the people that we surveyed were aware that Texas had passed some kind of law restricting abortion, they weren't always sure if abortion was legal or thought that it was completely illegal, even though there were certainly some ways in which people could get legal abortion care. And we also found in some of our interviews that people were worried that even calling a clinic could get them into trouble, or that if they visited a clinic, later on they could be found that they had broken the law. So one of the women that we interviewed told us that she felt like she was constantly on watch. She didn't feel comfortable going ahead and visiting an abortion clinic because she was so close to the 6-week mark. She said, I felt really uneasy if I were to go through with it here in Texas and then somebody turned around and said, oh, hey, we shouldn't have done that or something like that, and then get me into a whole bunch of legal trouble. I just didn't want to mess with it, and I just figured it was best to go out of state. So we heard from people who could have been able to get care in Texas that they were too worried about the legal repercussions to even seek care in the state. It was also really difficult for people to find care in another state because Texas is huge compared to the neighbor states. And so Texans seeking care in other states were just overwhelming the other facilities in our bordering states that were already caring for their own state residents. And then suddenly we're seeing hundreds of Texans every month. We do also know that for people, not everybody could travel out of state. That was just not an option for them for a variety of reasons, but they were also really worried about the legality of ordering abortion pills online or getting abortion pills by other means. We found in some of our surveys that 80% of people were somewhat or very concerned about the legality of ordering abortion pills, but that didn't necessarily stop them from doing it. One woman who did use medications to end her pregnancy, even though she ordered the pills online, she was very worried. She said, "I was worried the pills wouldn't come in time or I could be charged because I've seen online the laws. Legislators are just messing with people who they will and won't try to prosecute for things. And so maybe I could be arrested or something." Another person that we talked to, she did order the medications online, but it took several weeks for them to arrive, and she felt that she was too far along to use the medication, so she ended up continuing her pregnancy. But she said, if you take the pills and something goes wrong, and then you go to the hospital, they can arrest you for that now. You can literally go to jail for 2 years. It's not something that that you have to take very seriously. So while we know that self-managed abortion is not against the law in Texas, certainly we know people have been criminalized for their behavior, and the people that we were talking to were very aware of this as well. I think the last thing that I'll want to say that I think has relevance to the current context and kind of builds off of this last example I just provided is that people are really worried about what's going to happen to their social network. We heard from someone in the military or whose partner was in the military that whatever she did might compromise her partner's career. They were worried that taking their mom or their partner with them out of state could risk them being criminalized. And we also heard about people worried about the repercussions for themselves if they did need to seek follow-up care. I think in one of the more distressing cases we heard, there was someone who went out of state, obtained a medication abortion in a state where abortion was legal, and returned to Texas and experienced bleeding that made her feel uncomfortable. And she said, "The clinic staff said if I was in extreme pain, I should go to the ER, but I didn't because I was very, very scared of being judged. I'm not completely positive about the laws here and whether I was technically breaking a law, even though I went to another state to do it, but I did do something that's illegal here." And so I think we can see from these examples that people are aware that something is amiss in Texas, but they aren't really clear about what all of the policies are, what their risks are, but they do know that there are risks. And I think we're going to see this continue going forward so long as abortion remains illegal in Texas.
So you raised an interesting point about people, not seeking the care that they might have been recommended for fear of criminalization. And part of TexPEC's project and partnership is with clinicians, as you said. And I know you guys are looking at the change in the care that is being provided, or that even how clinicians are changing their behavior, not just patients, in light of maybe their own confusion or lack of knowledge about what the law is. Is there anything interesting you're finding about that, or anything that you're outside of that, anything that you're studying or thinking about that's interesting in in an environment of explicit criminalization?
Yeah, we have, as you mentioned, Blake, we have interviewed physicians and other healthcare professionals in Texas following the implementation of SB 8, and then in collaboration with some colleagues of ours at the University of California, San Francisco, also done some work with collecting physician narratives from people practicing in states where abortion has been banned. And what we've heard in Texas and in states across the nation is that clinicians are really feeling that their hands are tied as a result of these abortion bans. Even though there are these exemptions on the books for cases of medical emergency, sometimes, the rape exemptions, that these are really difficult to operationalize, and that we are hearing stories of patients getting sicker before physicians feel that they can intervene, either because of their own misunderstandings around the law, the guidance that they have gotten from their institutional leadership and institutional attorneys, or because of the lack of collaboration from some of their other clinical colleagues. They are being forced to wait until patients get life-threatening infections, hemorrhagic bleeding, before they can intervene. We're also hearing cases of other pregnancy-related care being pulled into the dragnet of these abortion bans. Things that should fall outside of the bounds of the bans, like treatment for ectopic pregnancy or miscarriage are also being compromised as a result of these abortion bans because of, again, the interpretation and legal guidance from institutional leadership that they've received.
So Heather, Carrie talked about the, kind of some mind-blowing and eye-opening numbers about both the numbers of people traveling to other states. I heard, I'm not good at math, but it's like almost a tenfold increase, perhaps, in people traveling to other states, and then probably an equal amount of distance. So, abortion funds really sprang up to address the need for payment for the procedure because of Hyde, because of states who don't pay for abortion care with their own Medicaid dollars. But then that, of course, is not enough for everyone to really actualize their pregnancy choice. So then we have practical support funds like Fund Texas Choice, who help with other needs, explicitly travel. So what, I guess the question built into that is, what did your work look like in a state as big as Texas with a limited number of clinics before Dobbs, and kind of how has that changed now a little bit? What are the greatest challenges, and how did you guys respond?
So Fund Texas Choice was founded in 2013 in response to closures across the state. Clinics were forced to close due to the passage of HB2. And because so many areas of Texas were left without clinics, particularly West Texas and the Panhandle, 35% of our callers still had to travel out of state. And in the time between 2013 and the passage of SB 8, people had to travel about 809 miles round trip. So it just shows that in a state this big, there is a huge barrier just due to the size. So after SB 8 was passed, 99% of callers had to leave Texas, so that was a jump from 35% to 99%. And the average round trip was 1,432 miles, which is a 77% increase in the amount of miles traveled. And when we had to pause services after the Dobbs decision was decided, we were helping folks in the Midwest, and they had to travel an average of 503 miles. And I think it's just important to note that the size of Texas itself is a barrier to people. Also, after SB 8 passed, before Dobbs, people traveled a total of 1.23 million miles, which is nearly 50 times around the Earth, which is a shocking statistic when you think that it is just people trying to access care and they should not have to circumnavigate the Earth.
And so now that you guys have restarted, what has changed, or is there anything that hasn't changed? Because Texas was so large and so many of your callers were already going out of state, is it just full steam ahead the way it has been mostly, or is there a difference? Are you noticing different questions from your callers? Are you helping in different ways that maybe you weren't before?
Yeah, so to build off of what Carrie was saying, the misunderstanding of Texas laws and just the complexity of abortion laws has created so much confusion for patients, for medical professionals, and for people, as well as law enforcement. So people will call Fund Texas Choice not knowing whether it's legal for them to access care, asking whether it's illegal for them to go out of state, asking if they're doing something illegal when they are getting help. And that just shows that these laws have created a chilling effect even when they're not banning travel. People just aren't sure what they are and what they aren't able to do. People are also more likely to seek care at these state-funded anti-abortion centers or crisis pregnancy centers, which can not only delay people from seeking the actual medical care that they need, but it can also shame people out of seeking care or traumatize them by the time they are able to get to a clinic, just require a lot more of their resources, time off work. And we also know that these centers will collect people's data and use that to call and harass clients, which further leads to surveillance and criminalization. law enforcement and private citizens are also misinterpreting the laws or feeling empowered by this state-sanctioned reproductive control. So we've seen since SB 8, there was a woman arrested in Starr County after self-managing an abortion and charged with homicide, even though there was no basis in law for this. Which just goes to show that law enforcement and prosecutors will harass, arrest, and charge people seeking abortions with crimes outside of the scope of Texas abortion laws if they want to. And that woman was also reported by a healthcare provider when she was seeking care, and it just shows that healthcare providers' misunderstanding of the law can lead to reporting people even when they're not required to do so. We've also recently seen people in Texas sued for wrongful death for helping someone access self-managed abortion, as well as a woman who was killed by her abusive partner after obtaining legal abortion in Colorado. I think both of these cases show how people have been emboldened to control, harass, threaten, and attack abortion seekers, and how these dangerous abortion bans and sort of state-sanctioned violence can be particularly for people who are in abusive relationships. Doctors are also confused about the law and afraid to perform abortions because of the threat of criminalizations, even when the law does allow for it, such as when the life of the patient is in danger. People have had to wait until they go into septic shock, or they have had to travel out of state for emergency treatment. We are seeing OBGYNs leave the state and a drop in OBGYN residency matches because people are afraid to practice here. Other states where abortion is illegal, such as Idaho, have been closing down the entire OBGYN units at their hospital, which is just leaving people without pregnancy care or postpartum care or miscarriage care as well. Also, the threats of criminalization just due to traveling can impact people in already vulnerable situations. So there are a lot of people in Texas who cannot leave the state due to their immigration status or criminal history, as well as teens who do not have the same rights as people over 18, and just people who are more likely to be targeted by the police are facing additional threats of criminalization. So there's basically a 100-mile invisible border from the Texas-Mexico border where anyone who is undocumented can risk being detained at CBP checkpoints if they try to leave the state. Teens also have long faced additional barriers to abortion care due to parental consent laws, but they are now facing additional criminalization threats. Anyone who takes them out of state could be charged with kidnapping or trafficking, and even parents who consent to this care can be charged with truancy if their kids miss school. And also, Fund Texas Choice clients are often people who are already targeted by police and law enforcement, including Black, Indigenous, and other people of color. So simply by having to travel these long distances, they're being put at risk for having to interact with police, which can lead to criminalization, especially if they tell them that they are seeking abortion care. And finally, we have seen policies being passed or introduced at the legislature that are sort of the next step in this framework of reproductive control. There were bills at the legislature this year to criminalize abortion patients and allow for wrongful death suits. And like we said, even when these bills don't move, they can create confusion and have a chilling effect. We've also seen an increase in funding and the codification of the Alternatives to Abortion program, which again has the potential to further risk the mishandling of sensitive patient information and subject patients to surveillance. We have also seen a couple of fetal personhood bills this year, and what this can look like, or what it has looked like, is bills that allow pregnant people to use the HOV lane without another passenger in the car, or bills that calculate child support at the earliest possible date of conception. It's funny, but it's also really scary because allowing the codification of the concept of fetal personhood, or the idea that fetuses have the same rights as people, can lead to police using child endangerment or child neglect laws to criminalize pregnant people for behaviors that they believe are risky, which can really impact people in abusive relationships, people who work in unsafe environments, or people experiencing housing insecurity. And then we've also just seen a sort of next step in legislation after SB 8. This private enforcement mechanism is now being used to allow private citizens to enforce immigration laws. And we are also seeing other healthcare restrictions in the form of bans on gender-affirming care for minors. So just by restricting abortion and allowing these mechanisms, we're sort of seeing that, that impact be more far-reaching. And as for what hasn't changed, people still need abortions. They always will, and they always have.
So, Heather, you teed up a lot of what we'll be talking about all day, and you teed up the question that I had for Kathy as well. So obviously, with the Frontera Fund being based in the Rio Grande Valley and working with a lot of people who are on the other side of the checkpoints, it seems like the funds can't only provide funding, since a lot of people are unable to travel. So it'd be great if you could tell us a bit more, add specificity to sort of the ways in which, in addition to the criminalization of pregnancy, the immigration enforcement and surveillance affects the populations you work with.
Yes, of course. So Frontera Fund was founded in 2015, and it was in response to a very looming impact of how the valley is often disenfranchised by the state. There's a very high uninsured rate. There's high levels of poverty in our area, and there was only one clinic in McAllen, Texas, serving the entire Rio Grande Valley, and that's over 1 million people. And it was the only clinic between San Antonio, Texas, and Mexico City. So it's like 8 hours south, 4 hours north, a lot of land to cover for one clinic. Frontera Fund was first founded as a practical support fund, funding travel like Fund Texas Choice was doing. And as we continued to gain speed and people really got to find out about Frontera Fund, most of the calls were just needing abortion, like financial support for their abortion care. So we started to include that as well. What's unique about the valley is that we are on the border, and it's a lot of land to cover, and we do have the Customs Border Patrol checkpoints 100 miles north of border crossings. So in the valley alone, there are 4 checkpoints. There's one internal, to go to the beach, Boca Chica Beach, and then there are 3 going out of the main highways anywhere in Texas. So for someone who is undocumented, that poses it's impossible almost to get abortion care, to travel out for care. So people who are undocumented cannot travel north because of the Border Patrol checkpoint, where just to paint a picture of how it looks, as you travel north, it looks exactly like a border crossing. It really does. And customs agents, everyone is required to roll down their window, and custom agents ask you if you're a U.S. citizen or not. So you can tell them yes, no, but it's really at their discretion and the mood of the Border Patrol agent. So if you tell them yes and they don't believe you, they can still detain you, and they will. And that's the reality. So there's really no options for people who are undocumented, but the only options they end up encountering are either facing deportation or being forced into parenthood. And that's the reality for a lot of people in the valley and along the border. A lot of our community comes from mixed status families. So whether maybe you may not be undocumented, but someone across the hall is, that's the reality of the nature here. So when SB 8 went into effect, Marsha pointed out, the only difference was the amount of people leaving, but there was still a whole community of people who couldn't leave. That's always been the reality of the culture in the valley. So because we received an influx of rage donations, from everyone being so mad that this happened, we were able to expand our service area to serve the entire border all the way to El Paso, because shout out to our other border fund, West Fund. They were funding financial support. However, they were not funding practical support. And Fund Texas Choice was handling the entire state. So we expanded our service area, and we're funding travel for 12 hours of land. And with that, we went from funding 12 people the entire year prior to SB8 to like 30 people a month. So it was a huge jump. And we considered ourselves travel agents at that point. We really got to know hotels and the systems. And jumping back to sort of what the culture is like in the Valley, a lot of people have never left the Valley before, maybe to San Antonio to visit family or to Mexico, because we're right there and it's a common occurrence to cross and hang out in Mexico. People had never left the state. And so where the Valley is located, it's the furthest geographical point from any other bordering state in Texas. So the conversations on the phone were not just like, okay, where do you need to go? When's your appointment? It was, here's what to pack, here's what to do, get to the airport 2 hours early, so on and so forth. And having to do that in Spanish as well, because people of all different languages and cultures were being forced out of their home to seek abortion care. So I learned a lot of Spanish doing the helpline. So I wanted to kind of paint a picture of the stark, there's stark changes, but also not really, because one clinic serving millions of people is just unrealistic. And now there's no clinic. So I wanted to talk a little bit about the criminalization aspect of it. So the differences that I have experienced on the helpline have been, it's very eye-opening and interesting. So prior to the fall of Roe, it was very straightforward, okay, this is the care I need. What is this law? Why do I have to leave? I just found out I was pregnant. Very important questions to ask. But now what we're experiencing is people asking what will if they will go to jail if they are hemorrhaging, or people have a different blood type and they risk hemorrhaging if they take medication abortion. And they're wondering, so if I tell my OBGYN that I'm bleeding, will they throw me in jail? Will they arrest me, or will they call the police? And the reality is, that's a very good question to ask, because maybe. Because these laws are very confusing on purpose. We saw it last year with Lizelle Herrera, which I'll definitely expand on. And people in the Valley or in the border areas are even more concerned of the risk of criminalization because of the layers and layers of policing and the hyper-militarization of the border. Not only do we have local police, state troopers, ICE, Customs Border Patrol, but we even have the National Guard and the Coast Guard, that especially now with Title 42 being lifted. So, and like Heather mentioned, there are bills moving right now, like HB 7, which would implement a Texas border force under the Texas Rangers, where thankfully it's not vigilantes anymore, but it is still people who were ex-military and former border patrol, and it's that same mechanism of the aiding and abetting vigilante fine from SB8 that is being implemented with HB 7. So that's going to be another layer of policing. So any conversations that we have, any questions that people ask, it's very important to let them know, just be careful with who you're talking to and the questions that you're asking, because of the fact that in the Valley specifically and in areas that are over-policed, like the Valley, that's why it was very eye-opening when people ask me that, will I go to jail? The answer is, I can't tell you yes or no, because maybe, yeah.
Well, then I think we do need to hear more about the Lizelle Herrera case. And I mean, so even though in principle pregnant people cannot be charged with abortion, although charged with all kinds of other things, as you all have talked about, I think the Lizelle Herrera case where, and this was even before Dobbs, right? And I guess after SB 8 was passed, but she was arrested in Starr County for being suspected of having had an abortion, and as Heather already said, it was a healthcare professional who turned her in. And the Frontera Fund did a lot of work. I mean, you all really came came in and joined forces with a lot of folks, and I think it'd be useful for us to hear about how that happened, and also maybe, I mean, I'm struck by your closing comments a second ago, because a lot of what we talk about is the need to do public awareness about what the law does and doesn't prevent, but that doesn't mean that when somebody's on the phone you can't say, it actually doesn't mean that you're not going to be arrested. So anyway, I'll let you take it from there to tell us about the case.
Okay, yeah, so it was April the 8th last year. That was my 26th birthday. I was actually at home getting ready to have people over for my birthday, and then a friend of mine shared an article from the Monitor, breaking news, and it was that Lizelle Herrera was arrested and put in jail and charged with murder with the $500,000 bond. And it was, I'll never forget that day. I immediately called Zaina Zamora, my boss, and the board, and we all came together and we're like, okay, put your birthday on pause because this is messed up and we need to do something about it. And it was also a reaction of it finally happened, because was going to happen, and we knew that it would happen in the Valley specifically. So immediately, there are other reproductive justice organizations in the Valley. I want to name South Texans Reproductive Justice and the National Latina Institute for Reproductive Justice. And my very close friends, we immediately jumped on a call and said, we need to do something about this as soon as we can. So we deviated and we organized actions at Starr County Jail, and we also got in contact with If When How and Blake and everyone, and who was anyone that we knew could be of a very useful in helping Lizelle get out of jail. So the following morning, we mobilized and we went to Starr County Jail, and we held an action outside, letting the community know what was going on, informing the media in a strategic way, because we knew something like this could easily been sensationalized. So we took control of the narrative and let people know that this happened because of laws like SB 8. It's confusing. So that's why the police were called, and that's why she was thrown in jail, when we all know, it was explained that there was not that shouldn't have happened. That's not what the law was written to do. So in addition to mobilizing and getting people there, we had the entire country call Starr County Jail and get her out. We messed up that phone line. And then we switched to calling the district attorney's office, and that closed his phone line, and then emailing him, and we got locked out of his he got locked out of his email, and 2 days later Lizelle Herrera was released from jail. It was very exciting. We were so happy for her, and it was thanks to everyone involved. However, it became more of this is going to be a rubric for when this happens again, because it will. And that was what happened. And I'm actually, on a lighter note, really proud of the work that we did, because that was organizing, and that's a huge part of why abortion funds are important. And we all banded together, and those are one of the small wins that you have to hold in a climate like this. And yeah.
Thanks, Kathy. That's great. And thanks to all of our panelists for really giving us insight and preview of lots of stuff we're going to talk about today of all these other issues.